Diabetic retinopathy is an ophthalmic complication of diabetes mellitus. And so itself we can understand that is a disorder which is developed by a generalized disease. The diabetes is not a disease which is localized to a particular organ. It is a metabolic system. Generally, it is affecting the system, generalized system. The metabolic activities are affected, and so that is why it is making complications in different organs. There will be complication in the kidney, complication in the eye, complication in the nerves, complication in the brain, complication in the heart, like that, because it is generalized. So itself, it may develop at any organ. And why in a particular organ, that is a very serious question. If the patient is having some etiological factors which is common to diabetes and also to that particular organ, then the complication will be developing in that organ. If the patient is having some etiological factors which is common for diabetes and for the eye disease, if so, that patient will be developing ophthalmic complication. That is the actual position. There are so many etiological factors which are common for diabetes and eye disease. And in addition, the extra strain to the eye will be a factor which for easy development of ophthalmic complication. Late night and this eye strain works and too much screen works, like that, so many things are there, including dietary factors. So these are common, and if one eye is weak, then it will affect that eye first. It doesn't mean that it is a localized disease for one eye. It is not an external factor that causes this disease. For example, a wound or a trauma or an infection. These are limited to one eye only. But this retinopathy is not such a thing. It is a complication of a systemic disease which is already there. So the possibility of getting the problem in the other eye is possibility is very high, because the reason which one was developing the disease in one eye, that same reason is still existing. So the possibility of getting affected the other eye is very high. So in 99% it starts in one eye first and it is getting affected in the other eye also. It is not spreading from one eye to other eye. It is not an infective disease or a contagious disease, nothing like that. It is a common factor that is existing, that is diabetes. It is still there. It is not curable. So it will develop in the other eye also. That's all. So better to start some preventive measures if we see that one eye is affected, so that we can avoid the development of the same disease in the other eye. That is more important. If we see there is diabetic retinopathy changes in one eye, don't waste even a single day to make some precautionary methods, some preventive measures to avoid the development of the same condition in the better eye. Once it is developed, it is not so easy to get it cured or to control it. So always prevention is better than this treatment. So be aware that if there is a changes of retinopathy in one eye, immediately take the treatment, also preventive measures for the other eye. Actually, Ayurveda is a system which gives more importance for preventive measures. Prevention is very important in Ayurvedic steps. For the management of this diabetic retinopathy also, the preventive methods are very, very important. There are different types of oral medications, and also these external treatment procedures and extraocular treatment procedures are there to prevent the development of ophthalmic complications in diabetes, especially retinopathy. It is not that also I will say it is not a single eye drop. Apply these drops and it will be prevented. It is not like that. Treatment is never a magic or a miracle. It is the action or the result of some medications and also the effect of some treatment procedures in Ayurveda. Side by side, the control of diabetes is very important. That is the role of a diabetologist or a general physician. That is possible by different ways, and dietary factors are there, and tablets are there, injections are there, and so there are so many methods. By that method, blood sugar should be under control or diabetes should be under control. And for the prevention, we have to approach the patient with another mindset. Especially, there are some inpatient level treatment procedures to solve it. There will be here also we know this diabetes touches the microvascular system. So to avoid the complication in the eye, we have to maintain the vascularity or the blood circulation also. For that, we have to take treatment step by step. And even after the inpatient level treatment, there will be some simple medications to continue. Just like we continue medication for diabetes, but there will be some simple medications to protect the eye also. Inpatient level treatment is very important to make a basement so that the structures are stabilized, retina is making more functionally better, and vascularity is maintained. Then we can prevent the development of retinopathy in a diabetic patient.